Mike and Lori, how should patients bring up anxiety and depression with their doctors, especially their gastroenterologists?
Yeah, I think that is a super important question. And, in my experience, it's actually an issue that patients feel, some hesitance or lack of comfort in bringing up. Um, you know, I don't know the best way to do it, but I can tell you there is no wrong way to do it. You know, gastroenterologists who are used to taking care of patients with inflammatory bowel disease or a host of other gastrointestinal conditions are well aware of that mind body connection. And while the gastroenterologist might not always ask about it at every visit, um, they certainly are quite receptive, and please, please do bring it up if it's a concern, or even if you're wondering if it may be a concern. This is something that we as a GI community hear a lot about and have a fair amount of experience with.
Yeah, and I kind of echo those conversations. I mean, I think as a psychologist who's in an IBD clinic, it's very common for our gastroenterologists to feel comfortable just pulling me in. Like, can you come in? This person's, seems like they're depressed or they're anxious. We also have social work and other mental health providers at our facility. But one thing that patients might benefit from is actually sort of taking a online sort of self depression quiz that they bring into their doctor as a way, if they're uncomfortable sort of articulating it themselves, where they kind of check off, these are the symptoms I'm experiencing, this is the frequency with which I'm experiencing them, and I'm kind of worried that this might be depression. What do you think, doctor? And I think sometimes that helps facilitate the discussion, because sometimes that added piece of paper can make a difference. As Mike was saying, in a very short period of time where you don't have a lot of coverage of activities, a lot of times patients will deprioritize the depression component. They'll get really focused at the visit on all of the other things they need to do, their vaccinations, their surveillance, their medication regimen, what have you. And then as they're leaving, they're like, oh, shoot, I forgot to mention that depression problem. And so I think it's also important for the patient to say to the doctor, when we're done talking about this, I have one other issue I'd like to bring up. I'd like to, talk a little bit about my mood recently, or my sleep difficulty recently. And then that helps open the door for the doctor to not forget to check in about that as well.
I think those are really good suggestions, Lori. Thank you for bringing them up. And again, just to refer back to an earlier part of this webinar, because the symptoms of depression and the symptoms of IBD have a fair amount of overlap. While this is sometimes a important topic to bring up, it's a or sometimes a challenging topic to bring up, it is a super important topic to bring up as well. It helps the doctor and the patient really focus the treatment on what the root cause is. Is it the inflammation? Is it the IBD? Is it depression, or is it a combination of both?